This is a progression of engaging one of your deeper trunk muscles, or what's called your TA. First, we're going to find that using 2 fingers, and then we're going to place that on the pointy hip bones, go about 1.5 inches inward toward the belly button, and then draw the belly button toward the spine. You should feel like the tissue under the fingers depresses. That means you're contracting the correct muscle. We're going to combine that with a leg blower, so lying on the back. We're going to start with the easier version, and then work our way up. So doing that same thing, fingers on hip bones, then walking the fingers about 1.5 inches toward the belly button, gently drawing the belly button to the spine, making sure that the back doesn't arch upward. Try to minimize the arch. Sometimes it can be helpful to think of pressing the back into the ground. So maintaining that contraction, we're going to start with a really gentle leg lift, making sure that the abdominal muscles don't dome toward the ceiling, so they don't kind of cone outward. Try to draw the belly button toward the spine. If that feels pretty good, then we're going to make it more challenging by doing 2 feet at the same time, up and down, making sure that there's no doming of the abdominal muscles. And then the more advanced variation of this is to do this with the legs straight. You can do 1 leg at a time, slow and controlled, making sure that the abdominal muscles don't dome out. Slowly, of course, the lower you go, the more challenging it is. And then you can do the same thing. More challenging version is with both legs down, and then again, making sure that the abdominal muscles don't start to cone toward the ceiling. So belly button to spine, maintaining that, slowly lowering down. Of course, again, the lower you go, the more challenging it is, and then slow and controlled back up.